Enrollment coming up quick, many are facing the pressure of selecting health plans. New data from Fidelity shows that while all generations say health is a top benefit, many young people feel overwhelmed with this time of year.
Yeah, joining us to discuss in detail is Ryan Victorin, Vice President and Financial Consultant of Fidelity Investments. So let's talk about this.
Good morning, Ryan. So what can you tell us about why so many people are feeling stressed? I mean, I personally think it's probably because there's so many options.
Yeah, good morning. And honestly, with the cost of healthcare continuing to rise, we just know choosing a health plan that's right for you and your family can be difficult. And in fact, more than half of the people in our survey say they feel overwhelmed, like you said, or even discouraged when it comes to annual enrollment. Yeah. And interestingly, while women and younger generations say they feel they're more overwhelmed, older generations tend to feel more of that discouragement around the process of choosing health benefits.
Well, yeah, I mean, because it's almost a given every year. You know the cost is going to go up, right, in your plan, your healthcare plan, whether you're looking at work. But can you kind of talk about how we can stay on top of these healthcare expenses, since we know that plans are always more expensive?
Yes, absolutely. With the rising cost, there's a few steps that you want to take, especially during that open enrollment, that might help put you on a stronger financial footing when it comes to your health. And what most people are familiar with is researching those different options we were talking about, things like premiums, deductibles, and out-of-pocket maximums. But you also want to make sure you understand what kind of preventative care your benefits may offer, including things like mental or physical health support, which may also be low or even no cost to you. And then lastly, for those that have a high deductible health plan, you have access to something called a health savings account, otherwise known as an HSA. And this is something our study finds that about half of Americans are unfamiliar with.
Yeah,
probably not utilizing like they should. So, historically, young people aren't the people who are like, chomping at the bit to get a healthcare plan. But we did say at the beginning that young people are feeling overwhelmed. Are you finding that more young people are looking for benefits like that, especially with the mental health crisis and other things that you mentioned?
Yes, absolutely. Younger generations rank mental health as actually a bigger concern than older generations do, as you can imagine. And so they are seeking things and things that they can get help with. And what we love to see is that they're actually starting to go to their employer and they're looking for help. We love that. So they're leaning in.
All right, good to know. Any big differences that sort of across the board that you can highlight, that you can tell us about this year as people get ready to look at plans?
Yeah, absolutely. While a lot of people are focused on their physical health, like I said, sometimes they're prioritizing different things. But one of the things that's a big difference that I want to get to that many people just don't understand is a little bit more about those HSAs. And there's actually three really important federal tax advantages that come into play when it comes to HSAs. And an HSA is an account that you and your employer can put money into to help save for those healthcare costs. So the three advantages that we talk about, we call them the triple tax advantage at Fidelity. The first is that when you put the money in, also known as your contributions, they go in pre-tax. Second, you can use that account to pay for qualified medical costs tax-free. And third, you can invest that money to potentially grow, to use that money in the future. All of that growth is tax-free too, and assuming it's used for qualified medical expenses. And the thing to remember too is that that account is always yours. It's not tied to the job you have, and the funds never expire. HSAs are a really important part of an overall financial plan, and we know there's a strong link between health and financial well-being, important to all generations. And our job is just to help you figure out where it fits.
All right, good information. I was going to ask if it expired, so thanks for covering that. Ryan Victorin with Fidelity, thanks so much for joining us this morning.